Assalamu alaikum warahmatullahi wabarakatuh. Good morning. One small positive thought is the morning can change your whole day. Introduction. Health has been declared as a fundamental human right. This implies that the that it is that has state has a responsibility for the health of people. National government all over the world are striving to expand and improve their health care services. Healthcare services. The present concern in both developed and developing countries is not only to reach the whole populations with adequate healthcare services, but also to secure an acceptable level of health for all through those publications of primary healthcare programs. Health. WHO defines health as a state of complete physical, mental, social well being and not merely the absence of disease or infirmity. Changing concepts. Comprehensive health care. This term first used by the Bore community in 1946. By comprehensive services committee meant provisions of integrated prevention, preventive, curative, and promotional health services from womb to tomb to early individuals residing in a defined geographical area. Bore committee defined comprehensive health care as having the following criteria: provide adequate preventive, curative, and promotive health services, be as close to the beneficiaries as possible, has the widest cooperation between the people, services, and the profession, is available to all irrespective of their ability to pay, look after specifically the vulnerable and weaker sections of the community, create and maintain a healthy environment both in homes. Basic health services. In 1965, this term was used by UNICEF and WHO in their joint health policy. A basic health services is understood to be a network of coordinated peripheral and intermediate health units capable of performing effectively a selected group of functions essential to the health of an area and assuring the availability of component professionals and auxiliary personnel to perform these functions. The change in terminology from comprehensive to basic health services did not affect quality or content of health services. Health for all. The attainment of a level of health that will enable every individual to lead a socially and economically reproductive life. The 13th World Health Assembly in May 1977 resolved. The main social target of governments and WHO in the coming decades should be the attainment by all citizens of the world by the year 2000 AD of a level of health that will permit them to lead a socially and economically productive life. Health for all by 2000 AD. The Alma-Ata Conference called for acceptance of the WHO goal of health for all by 2000 AD and primary health care as a way to achieve health for all. Alma-Ata Declarations. Health is a fundamental human right, and that the attainment of the highest possible level of health is the most important worldwide social goal. The existing gross inequity in the health status of the peoples, particularly between developed and developing countries, is politically, socially, and economically unacceptable. The economic and social development based on a new international economic order is of basic importance to the fullest attainment of health for all. The people have the right and duty to participate individually and collectively in the planning and implementations of their health care. Almata declarations. Government have a responsibility for the health of their peoples, which can be fulfilled only by the provision of adequate health and social measures. All governments should formulate national policies, strategies, and plans of actions to launch and sustain primary health care. All countries should cooperate in a spirit of partnerships and services to ensure PIC for all peoples and acceptable level of health and for the peoples of the world by the year 2000 can be attained through a further and better use of the world's resources. Thank you very much.